make sure that by the end, you will have all of your questions answered and you feel confident in being able to fill out your ballot. So with that said, we are going to go ahead and jump right in to our first proposition. And I'd like to introduce Sammy Lawrence. Sammy is with the Proposition 30 campaign. And so Public Health Advocates has recommended a yes on Proposition 30. And so the first question, which I'm going to ask all of our panelists, is what is Proposition 30?
Awesome. Thanks, Flo. And thanks everybody for being on today. Very, very grateful to be here and grateful for your partnership. Apologies if my voice isn't as great today. I've got this like sore throat that apparently is going around. It's a bit of a bummer, but I couldn't be more excited to be here. Let me just make sure I have my notes pulled up here. So what is Prop 30? Why are we supporting Prop 30? Like, what is going on? So as you all know, climate change is having a devastating impact on our state, on our country, with record-setting wildfires, droughts, property destruction. It hurts our economy, right? Like people lose jobs. There was the sleepaway camp I went to burned down, and like not thousands of jobs, but kitchen staff, custodial staff, all those folks, like their job is gone because the camp burned down. And all of this is contributing to California's extremely poor air quality. It's the worst in the country and some of the worst in the world. It's a hazard to public health, and it degrades our quality of life in every part of the state. In fact, 38 out of 39 million Californians breathe polluted air, unhealthful air. So to solve this crisis, we need to address two sources of air pollution, and those are transit emissions and catastrophic wildfires. And we need an immediate and long-term sustained investment in addressing both of these. And Prop 30 does just that. Prop 30 would raise $100 billion over 20 years, dedicating 20% of funds to preventing and suppressing catastrophic wildfires, and the remaining 80% to zero-emission vehicles and zero-emission vehicle infrastructure. The measure also does so extremely, what I believe, and I think many others, does so in a progressive way, taxing at a very, very small rate, at 1.75% of income, only income over $2 million. So if you make $1.9 million and you have all this capital gains coming in, you're not taxed at all. This is a backfill from where we were prior to the Trump tax cuts. And it would only, again, address income or target income over $2 million. Additionally, the funds are allocated in a progressive way. Of those 80% of total funds raised for zero-emission vehicles and infrastructure, half of all of that money is dedicated to low and middle-income Californians, ensuring that folks who most need and drive the most miles get access to these to this infrastructure and these vehicles.
Thank you so much, Sammy. So I just want to highlight a couple of things and maybe, get to some of the key questions that people may have. So you talked about how half of the funds that are set aside for the zero emission vehicles, so these are our electric vehicles, et cetera, are dedicated to people who are low income. And I want you to really kind of make the point, because I've been hearing, from people that this is kind of a corporate carve out for Uber and Lyft. And so this is just their way of not, abiding by the adage that polluter pays, and instead convincing, granted, the rich people, but certainly wealthy people in California, the taxpayers, to pick up their cost. And so what would you say to that? And can you talk about who's really going to benefit from this?
So I'm going to get to that question. And I also think it's important to have context here and how this measure was written. This measure was written by two groups, among others. One, Move LA, which is a transit enviro sort of housing focused group here in Los Angeles, and Spur, which is a think tank up in SF. These are both organizations that are not only concerned about our environment, they're concerned about transit and equity around transit and ensuring that our housing opportunities match those transit opportunities as well. They drafted this measure because they believe and they know that we need a sustained and long-term funding source for these projects. And if we don't have that, all the work that we're doing, all this talk about, we have a climate crisis, we need to act now. Like, sure, we have a budget surplus, like we can dedicate one-time dollars, but without a sustained investment, there will not be enough money for enough time to get us to where we need to be in terms of our air quality and pollution. They were both interested in strategies that would also spur national and international efforts that would mimic something like a Prop 30. So in terms of understanding the Lyft carve out, where Lyft came in terms of like just getting involved, Spur and Move LA wanted to put this on the ballot, and they approached Lyft because they wanted money to help get them on the ballot. As you all know, getting on the ballot is very exhausting and very, very expensive. And that's when Lyft sort of came into the conversation. But the notion that Lyft, back to your specific question, gets a carve out here is just simply not true. And they receive no preferential treatment, and no company receives any preferential treatment under Prop 30. It will increase the number of electric vehicles by 10 to 15 million on the road, benefiting all Californians, all drivers, and including the small fraction of drivers who drive for rideshare companies, Lyft and Uber, et cetera. And according to the California Air Resources Board, only 1.25% of light duty vehicle miles traveled in our state happens on rideshare platforms. So the way I see it is like, we have all this money. And by the way, that 1.25% is if every single Uber and Lyft driver and any other rideshare corporation driver takes full advantage of all the rebates, right? It is in no way, shape, or form a carbon.
That makes total sense. And in the interest of time, we're going to move over, but we do have a question from Aaron Brinker that I'd love for you to be able to answer in the Q&A. And also just to be able to talk about one of the questions we didn't get to, which is who specifically supports Prop 30. So thank you so much for that. And if anybody who's on the call has questions about Prop 30, please feel free to use that Q&A feature at the bottom of your screen to ask those questions so we can make sure they all get answered. So now we're going to move on to Prop 31. And so I'd like to introduce you to Madison Frizzy, who is with the Prop 31 campaign. And same question to you, Madison. What exactly is Prop 31? We hear it's a referendum. What does that even mean?
Yeah, Prop 31 is a referendum that can be very confusing. First of all, thank you all so much for having me. We really appreciate the time to be able to talk about this important measure that's going to be on the ballot. So to answer both of those questions, Prop 31 was originally a bill in the California legislature, SB 793, which passed with bipartisan support and was signed by the governor in 2020. So you may be thinking, well, why am I voting on this? That's what a referendum is. So Big Tobacco spent over $20 million to qualify this referendum for the ballot in order to delay the implementation of this important policy. And give them a little bit more time to sell these dangerous flavored tobacco products in California. So Prop 31 prohibits the sale of dangerous flavored tobacco products aimed at getting kids hooked on nicotine and creating a pipeline of lifelong customers for Big Tobacco. We know that Big Tobacco uses candy flavors to disguise and deliver massive doses of nicotine, which harms adolescent brain development, which impacts attention, mood, impulse control, and other health outcomes. So a yes vote on Prop 31 will help keep California kids safe from being targeted by Big Tobacco. Again, referendum are a little bit confusing. So because in an initiative, the people who collect the signatures and put the policy on the ballot are the yes side. In referendum, it's kind of the opposite. So in this case, a yes vote will mean that you are standing with more than 200 organizations and nearly 150 elected officials voting yes to protect kids from the dangers of flavored tobacco.
Thank you so much for that, Madison. So, you know, one of the big issues, especially, you know, coming out of 2020 and 2021, you know, with George Floyd and Eric Garner has been this question about, you know, the criminalization of Black and brown people and whether or not by, you know, banning these products, this will somehow criminalize people and contribute to some things that people are concerned about. So can you say a little bit about that? Because I know the campaign has spoken out about this really directly.
Yeah, absolutely. So just to clarify, Prop 31 applies to tobacco manufacturers and retailers and in no way criminalizes people for possessing, using, or purchasing flavored products. And as a matter of fact, Big Tobacco has a long history of targeting marginalized communities, getting them hooked on flavors like minty menthols and other dangerous flavors. So, for example, in the 1950s, fewer than 10% of Black Americans who smoked used menthols, and today 85% do, thanks to Big Tobacco's predatory marketing in Black communities. As part of the 200 organizations that I mentioned previously who are supportive of this policy, that includes the California NAACP, the African American Tobacco Control Leadership Council, the California League of United Latin American Citizens, are all part of the coalition in support of Prop 31. Prop 31 is going to be able to help end the cycle of addiction, disease, and death that tobacco products have perpetrated on these California communities, which is why we're urging you to vote yes.
Thank you so much, Madison. Any other hot topics you want to share with us? I think, in a state that has such a low, smoking rate already, we have seen the evidence of what tobacco policy does in terms of shifting our norms. But I'm curious if you have any other things you want to share. And if those of you have questions, please feel free to put them in the Q&A feature so that Madison can answer them for you.
Yeah, I'm happy to answer any questions that come in through the Q&A, but just would like to really emphasize that these candy flavors are targeted at kids. If anybody has seen the advertising or even the packaging that comes on these candy flavored products, you can tell that they're not targeted at lifelong smokers who have been smoking for 40 plus years. These are targeted at kids. More than 2 million middle and high school students use e-cigarettes, and 4 out of 5 kids who use tobacco started with a flavored product. So it's very clear that Big Tobacco is creating this lifelong pipeline of customers by getting them started on flavored products when they're really, really young and their brain's not fully developed. So again, would just like to urge this group to vote yes on 31 to help protect kids from the dangers of these flavored products.
Thank you so much, Madison. And again, if anyone has questions about Prop 31, please feel free to put them in the Q&A. We have just gone over Prop 30 and Prop 31. Public Health Advocates has a voter guide, and we have recommended a yes on both Prop 30 and Prop 31. And now we are moving to one of the places where we are a no. And this is Prop 27. So I have with me Kyle Griffith, who will be talking about why we are a no on Prop 27. And so, but first, we want to just explain a little bit about what is Prop 27, Kyle.
Absolutely. Thank you, Dr. Kofer. Prop 27 would legalize online and mobile sports betting here in California. I'm sure many of you are wondering, why now? Why is California faced with multiple sports betting ballot measures? Ultimately, that comes down to, in 2018, the Supreme Court issued a ruling that essentially left it up to each state to determine how they authorize sports betting, whether it's online, in person, or some combination of the two. And so, our coalition was formed to oppose Prop 27, in large part because it would turn virtually every cell phone, tablet, and laptop into a gambling device. And it's being sponsored by out-of-state corporations that are going to take 90% of revenues out of the state without making significant investments. And, Prop 27 will lead to additional addiction, and we think it's the wrong choice for California.
Thank you for that. So, you've talked a little bit about, what the challenges are and what Prop 27 does. I'm curious to know, one of the big arguments, for why people say, oh, well, maybe we should vote for this, is that they say the money is going to go to homelessness. So don't we want that? Why would we say no to this?
I mean, for Californians, everyone knows that homelessness is one of the biggest issues facing our state, but Prop 27 is simply the wrong solution. I mean, especially as Californians, we know that any claims that a single funding source are going to solve all of our issues should be met with a healthy amount of skepticism. I mean, the lottery was supposed to solve education funding, right? And Prop 27 is guilty of much of the same things, of failure to develop the revenues that would be necessary to support these programs. The proponents of this measure do extensive polling in other states, claiming that online sports betting is going to solve that problem. In Colorado, is going to fix the Colorado River watershed. In Florida, it was supposed to fix teacher pensions. But what the proponents of this measure have done is they've included a loophole that allows them to deduct the free and promotional bets that they offer when they enter a market. If you're a sports fan like me, I'm sure you've seen a commercial that says your first 3 bets are free, or we'll match your deposits up to $1,000. Each of those promotions can be deducted from the overall amount that California can tax. And in other states, these online platforms were deducting 50 or more % of their taxable revenues, claiming them as losses. And what that means is states are, left with huge funding shortfalls. For example, in Colorado, they online sports betting deducted 60%, and the state legislature had to use $15 million in taxpayer revenue to make up for that funding difference, and actually have passed additional legislation to close that loophole. That exact same loophole exists here in California, and the platforms are more concerned about cornering the biggest market left in the country that has not authorized sports betting than trying to solve the homelessness issue.
And so thank you for that, because I think that's, one of the major, arguments that people are kind of making for why, right? And we're seeing the big billboards that say yes on 27. So you talked a little bit about the jobs that, aren't going to come to California because this is online. And so, so the revenue is really going to be leaving the state, and how much it could even cost us. And that is unknown. But I'm curious, public health advocates, obviously we care a lot about public health. And so one of the things you touched on a little bit is, gambling and gambling addiction, and what the difference is between in-person gambling and online gambling. And I'm wondering if you could just speak to that for a moment.
Sure. Online gambling has not been around in the US as long as it has in other places like the UK and Australia. And in study after study, it's been found to be far, far more addictive than traditional forms of gambling. And I mean, one of the big reasons is access. Everybody has a cell phone in their pocket, and if people are able to satisfy their addiction whenever, wherever they want, they're going to do so. And we're already starting to see some evidence of increases in addiction borne by online sports betting in other states that have recently authorized sports betting. For example, in New Jersey, which authorized online sports betting in 2018, they saw a 500% increase in calls to the problem gaming hotline. Connecticut is a 300%. And in state after state, you're hearing the same stories. People are becoming addicted faster, and they're losing everything far faster than if they're going to an in-person casino.
Thank you so much, Kyle, for being here with us and for answering these questions. And if there are any questions about Prop 27, please feel free again to use the Q&A feature to be able to ask them in the chat. And just for those who may have joined us a little bit late, we've gone over Prop 30 and Prop 31, which Public Health Advocates has recommended a yes on. If you joined us late and have questions about those, you can still ask those questions to our panelists and our experts on that in the Q&A feature. And we just went over Prop 27, which we have recommended a no on. Some of you may be wondering why we skipped Prop 26. And we only skipped it because Public Health Advocates has taken a neutral position on it. We are deeply concerned about increases in gambling, but we also want to stand in solidarity with our Indigenous communities. And they are actually the ones that are sponsoring Prop 26. And so for that reason, we've just taken a neutral position on Prop 26. And we actually have a video, which I'm going to ask if Jessica or Holden might be able to drop the link to that in the chat, where our state policy director and I kind of go over the difference between the two and why we've chosen a no position on Prop 27 and why we took a neutral position on Prop 26. So I hope that's helpful to all of you. So now we're going to move on to Measure O, which is a local measure in Sacramento. It is also one of the measures that we have taken a no position on. And it also deals kind of, in a really direct way with homelessness. And so for that, we have Dave Kempa here to talk, representing the No on O campaign. So welcome, Dave.
Thank you, Dr. Flo.
And can you tell us a little bit about what Measure O is?
Yeah, absolutely. And I'm very glad to have you here with me in case I forget anything. But there's a number of things to this measure. Effectively, it was brought on by corporate interests here in the Sacramento region, led by the Sacramento Metro Chamber, as well as region business, to try and, in an over-encompassing term, address homelessness, right? This includes a number of things, but at its core, it's trying to find a way to circumvent what is called the Boise ruling, which ruled that, oh, I'm sorry, I'm about to get a phone call here, sorry. That ruled that if you try and sweep a homeless tent or camp when there are no shelter beds, indoor beds in the region, then that is in fact a violation of the person's Eighth Amendment right. It is cruel and unusual punishment. What this is trying to do is find a way to continue particular sweeps in particular circumstances, because the Sacramento region does not have anywhere near enough shelter beds to address this situation currently. So, two ways in which it allows them to, or would allow them to try and circumvent Boise would be, the first one is if there are 4 or more tents in a camp and folks in those tents are not related, then they can sweep that camp, force people to move. The second one would be when there is shelter space available, which this, we'll speak about this a little bit, but we'll discuss the term shelter space. If there's space available, they can ask folks to move at any time, no matter how many people there are, how many tents there are, right? Now, this also allows private residents to sue the city when unhoused folks are camped near their homes or business, right? So this is a bounty hunting law, similar to the bounty hunting laws in Texas related to abortions and private citizens being able to sue abortion clinics. So the city can be facing year in and year out a number of lawsuits from private citizens. Finally, it demands that up to $5 million of city funding goes towards this per year. Now, it doesn't say where or how or what it would be, so you don't know if it would go to these shelter spaces, if it would go to these lawsuits brought on by private citizens, or if it would go to, the cost of actually performing sweeps, which is very costly, right? And finally, there's a trigger on this. So the city of Sacramento and Sacramento County, famously in our region, do not get along as far as the homelessness crisis is concerned. The city has $1 billion in funding per year, generally, like its full budget. County is about 7 times that. County also has Health and Human Services, so it does have the public health arm. So they need to come to some sort of agreement for this to trigger and start up. That is sort of the long and short of it, right, Dr. Flo?
Yep, that's the long and short of it. So one question before we move to the Q&A, some people are saying it isn't perfect, but isn't this better than doing nothing?
I would posit no, and so would the Democratic Party of Sacramento County, the ACLU, the League of Women Voters, a number of stewards of the environment. This measure provides, in our opinion, no funding. This is funding that's already in the city. So that's funding that needs to come from the existing city budget. And this year, the city manager said, we're about to have a $40 million shortfall for the 1,100 shelter beds we actually have currently. So there is no funding coming in for this. It provides no housing, obviously, no services, mental health, physical health, treatment, none of that. And at the end of the day, no shelter. All it says is shelter spaces, up to 600 shelter spaces that can be specified as a 10 by 10 foot piece of concrete in open air. This is a smaller space than a jail cell and with fewer amenities, right? No plumbing, no environmental, no cooling, no heat. So that's problematic. And that, in our opinion, actually flies in the face of Boise, which demands indoor shelter. Beyond that, I guess those are the biggies, right?
Yep, those are the biggies. Thanks so much, Dave. If there are people who have questions about Measure O in Sacramento, please feel free to use the Q&A feature. Dave can answer so many of your questions and is deeply vested in these issues. If you have just joined us, just wanting to let you know, we talked about Prop 30 and 31, which Public Health Advocates is recommending a yes on. We talked about Prop 27, which we are recommending a no on. And we just went over Sacramento's Measure O, which we are also recommending a no on. And now we are moving to a new topic, which is going to be Prop 28. And Prop 28 is going to get us moving into a conversation about children. And so when we think about Prop 28, we actually don't have a representative who was able to join us today from Prop 28. They had an unfortunate last minute cancellation, but we wanted to share at least a little bit about why Public Health Advocates has chosen to say yes on this. So Prop 28 is a proposition that dedicates 1% of some of the existing school funding. So from Proposition 98, which is where a lot of the money that goes to schools comes from, specifically to music and art. And we recognize, especially post-pandemic, that a lot of our young people are really struggling with their mental health, and that for years we have not had adequate funding for the arts in particular. And so one of the other carve-outs for this is that some of the money is going to be specifically earmarked for economically disadvantaged schools, and that within those, 80% of that funding will go towards making sure that there's adequate staff to teach in person those classes, and then 20% will be able to go to things like supplies and training and other materials. And so we think this is a great way to be able to support our young people by taking just 1% to make sure that something like art and music is not seen as optional, is not on the chopping block for cuts, but is actually protected from the funds that exist. And as a reminder, this means that this is not a new tax. There will be no new money. It's just giving some guidance to how the existing money will be spent and making sure that, that those funds are set aside specifically for this purpose. And so as we talk about that, that's at the state level, Proposition 28, and we recommended a yes. We now move to Measure L in Sacramento, which has taken a very similar approach of protecting some of the existing money, so not a tax, and dedicating to young people. And so for that, we have Monica Ruelas Mares from Youth Forward here to talk about Measure L, and Public Health Advocates has recommended a yes. So welcome, Monica.
Thank you, Dr. Flo. Yeah, super happy to talk to folks about Measure L, which will be on your ballot if you live in the city of Sacramento. So hopefully we have some folks here that have seen Measure L. So Measure L essentially was placed on the ballot because the city continues to lack a long-term, dedicated, and growing funding stream for both youth and prevention. So of course, if you look at our city budget in the city of Sacramento, over 60% of our budget is spent on emergency services. That includes fire and police, right? And so what we've seen is a pattern of cities spending money on crises, right? And we don't spend enough money on prevention. And so what we see Measure L as is a real opportunity for the city to dedicate some funding to actually be spent on prevention. And of course, when we talk about prevention, we're talking about how are we funding our young people and what types of services and programs are available to them. Not only that, but the sustainability of those programs, the quality of those programs. And the city currently doesn't have an infrastructure to do an analysis either of the programs which youth are participating in now. And so what Measure L does is it brings that infrastructure to the city as well to support baseline and ongoing programmatic analysis. So whereas the city will claim that it spends, millions of dollars on youth right now, all of that money has been only one-time money. And so every year it tends to fluctuate. Thankfully, in the past year, well, not really thankfully, because we went through a pandemic, but the COVID relief dollars were able to go to youth. There were about $14 million that went to youth, specifically workforce development, youth mental health programs. There were some new programs that came about here in the city. However, that's all one-time funding. And where are those programs going to go once that funding is expired? Another reason why we're coming back to voters with another proposal for a children's fund measure is because, we, in the first attempt that we were trying to get this done, we had a lot of opposition from, the mayor and a couple of city council members who said that they had another way of doing this exact thing. And so SAC Kids First, which is the coalition behind this, we wanted a seat at the table, and we basically said, mayor and city council members, if you're going to propose a children's fund on a future ballot, we want to be a part of that conversation. So that's exactly why SAC Kids First and our partner organizations who serve youth, who actually work with young people, are putting this on the ballot again. Certain programs that this fund would go towards is specifically for mental health and emotional wellness of young people. Preventing and reducing youth homelessness is also one of the goals of the fund. Preventing and reducing youth substance abuse and youth violence, as well as supporting healthy development of kids 0 to 5. A little bit more specifics about the measure: it is not an increase in tax. It does redirect some of the city's general fund. So it tags cannabis tax. And so what we're seeing the cannabis tax as is an opportunity for the city to look at it as a tobacco tax. Let's fund some prevention programs and services with these dollars. So essentially the measure says 40% of revenues generated by the city's local cannabis tax would be earmarked and targeted towards this children's fund. That would be about $10 million in new funds for children and youth services on top of what the city already spends. So that's kind of Measure L in a nutshell. Yeah, I don't know if there are any questions.
Yes, so this is Sacramento's Measure L, and it is the youth fund. And, Monica talked a little bit about the cannabis tax revenue, and we actually worked with her organization and several others to produce a report about 2 years ago called When the Smoke Clears. I'll drop the link in the chat. And it really was looking at who was arrested and who was harmed by the war on drugs, in particular when it came to marijuana arrests. And Sacramento had the unfortunate distinction of having the highest disparity rate in terms of those arrests in the state. And so we really, in addition, one of the reasons why Public Health Advocates is so supportive of this is because it really is a restorative justice measure of being able to actually take the funding that harmed communities and actually to be a part of the ways in which we care for, we create community care and invest in those communities. So we're really glad to be able to have so many of the people on here today as partners, but especially Youth Forward and SAC Kids First. And so we are strongly urging you to vote yes on Measure L. So if you have any questions about Measure L, I know this has come up a lot around, how will the organizations be decided, and, what are some of the oversight measures? If you have those questions, please feel free to ask them in the Q&A feature. And if you're just joining us, just as a reminder, we have gone through Prop 30 and 31, which we are a yes on. We've gone over Prop 27, which we are a no on, as well as Measure O locally in Sacramento, which we're a no on. We've also gone over Prop 28 and Measure L, which we're both a yes on, Measure L being in Sacramento. And so now we're going to briefly talk a little bit about Measure C in Stockton. It is one of the local measures that we've also taken a position on. Measure C is a bond measure, a $250 million bond to expand career and technical education facilities in Stockton. And so this would cover education and engineering and healthcare and information technology. And it would also cover some of the infrastructure repairs needed for classroom safety and security. And so it's important to consider that a bond measure obviously is incurring debt. And it's something that, taxpayers are going to have to pay for. And so we often, when we think about bond measures, we really carefully consider if the investment is worth the cost. And in this case, we feel it is, especially given the work that we at Public Health Advocates are doing in some of the Stockton schools. We had conversations with the key stakeholders and those who were closest to the issue and decided that this was an important measure for us to support. So for those of you who are in Stockton or who have work in Stockton or have friends and family in Stockton, please urge them to vote yes on Measure C. And with that, I'm now going to move us over to Proposition 1. This is probably the proposition, of the country right now, just because of the conversations we've been having. And I have Amy Moy with us from Essential Access to talk about Prop 1. So can you just start with explaining to everybody what is Prop 1?
Sure. Hi, everyone. Nice to be with you all. Thanks for having me. First, I'll just quickly, by way of introduction, I'm Amy Moy, and I am co-CEO and Chief External Affairs Officer with Essential Access Health. And for those of you who aren't familiar with our organization, we champion and promote quality sexual and reproductive health care for all. And it is with that mission in our hearts and in our minds and in our actions that we were proud to be steering committee members of the Future of Abortion Council, and that we are proud campaign committee members for the Yes on Proposition 1 campaign. So Proposition 1 is simple but critical. The measure seeks to explicitly stamp and codify the right to abortion services and the right to use or refuse birth control in California's state constitution. So right now, we have an implicit right to these essential services in our constitution based on a right to privacy that is currently in the state constitution. But unfortunately, due to the most recent Supreme Court decision in Dobbs that overturned Roe v. Wade, the Supreme Court justices actually said there is no right to privacy, which is devastating and startling, not only for the impact that it's had across the country that enabled states in the huge swaths of the United States of America, both in the middle part and the southern part of America, that now have about 16 states that have completely banned abortion or enacted severe abortion restrictions. We anticipate that when court challenges are said and done, that up to 26 states, which if you do the math is more than half of the states in this country, will outlaw abortion or so severely restrict it that it will be out of reach for most, if not all, people in practicality. And so that's some numbers. By the numbers, what does that translate to be? About 26 million people across the country will not have access to abortion in their home state. That's 1 in 3 people of reproductive age. Now, before I depress you even more, because it is a stark reality, and of course, that will disproportionately impact people with low incomes, communities of color, and youth who already disproportionately face barriers to access to these essential services because of structural and systemic barriers in place to this care. But in California, with Proposition 1, we have an opportunity to say yes on Proposition 1, to say no, we will not go back. We have an opportunity to say yes on Proposition 1, to say that yes, in California, we value equity. Yes, in California, we value the fundamental right and freedom to have bodily autonomy, to make our own intimate decisions about our healthcare, to make our own intimate decisions about when and if to have children. And in California, we can vote yes on Prop 1 to say, yes, we believe in freedom and equity and justice. So we know that through polling, we're really lucky here, first of all, in California. Like, well, why do we need this in California? We have leaders, we have laws on the books that are supportive of reproductive health and freedom. And we are very fortunate here. We have true champions in California, from the governor's office across the administration, and a wide support, overwhelming support in the legislature. But unfortunately, we know that political tides turn. We're seeing it go back and forth at the federal level in Congress.
I think we may have gotten cut off by some internet access issues. So I'm going to give it a moment and hope that Amy pops back up. What an unfortunate pause to our conversation. We may have time, because we're a little bit ahead of schedule, to be able to come back to discuss this really important issue. But in the meantime, I will say that, Public Health Advocates supports Proposition 1. We firmly believe that reproductive freedom is a basic human right, and it's a critical component to public health. And so we are really honored to join with that coalition in helping to pass this, and really think it's important that we don't take for granted that just because California right now seems to respect that right, that will happen forever. Oh, Hi, Amy. We know internet is such a challenging thing, so I wanted to give you a moment to finish your thought.
Sorry, I hope I didn't freeze in a really funny face. But anyway, we know that in California, we also have broad support for these issues, but it's an awareness campaign. So thank you for joining. We not only need to win on election night, but we need to send a clear message that in California, this is what we believe. So urge you to vote yes on Prop 1, and then also share information and encourage your friends, family, colleagues, networks, and let them know that choice is on the ballot in California. So we've heard that when people hear that, they're 25% more likely to vote. So to kind of fill out their ballot, drop it in the mail, or drop it in a voter drop box, or vote on election day. So thanks for the time to share information. I could put my contact information in the chat box in case anybody's interested in joining us for text banking or to learn more about the campaign.
Yes, please do, Amy, and thank you so much. And again, we just went over Prop 1, which Public Health Advocates is a yes on. We've also gone over Prop 30 and 31, which we are also a yes on. We have gone over Prop 27 and Sacramento's Measure O, which we are no's on. We've gone over Proposition 28 and local Sacramento Measure L and Stockton Measure C, which we are also a yes on. Again, just went over Prop 1, which we're a yes on. And so this brings us to our final proposition of the day, a really important one that I'm really thankful that we have Renee Saldana with us from SEIU UHW to be able to talk with us about Proposition 29. And so this is one that really infuriates me. So I'm glad we have a few extra minutes to talk about because the opposition really just makes me so upset as a public health person. So can you just talk to us a little bit about, what is this proposition and why are we seeing it for the third time?
Sure. Thank you for that introduction. So, we put up this proposition, SEIU United Healthcare Workers West, because dialysis care is in crisis and patients' lives are being put at risk. We put up Prop 29 again because we want to protect dialysis patients and improve the care they receive. As it stands, the current model of the industry is predatory, it hurts patients and consumers, and it's truly an outlier in terms of how lucrative and profitable it is. Right now, the dialysis industry is taking advantage of patients who need this life-saving treatment, and it's taxpayers who often foot the bill. Just for anybody who's not familiar with dialysis, dialysis is a process that keeps patients alive when their kidneys fail. They have their blood taken out, cleaned, and put back into their bodies. It's really difficult. It puts their bodies under a lot of stress. They can pass out, they can suffer strokes, they can have heart attacks or bleed out uncontrollably during or after treatments. So, this is a sector of very vulnerable, fragile patients in this, in our state. And these patients don't have many options to shop around for treatment. There are two corporations that dominate the dialysis industry, DaVita and Fresenius, and together they're the ones who are opposing this measure and all those commercials you're probably seeing. Together they own approximately 75% of dialysis clinics in California. These two corporations have done everything possible to stop patients and workers from improving the quality of care inside their facilities. So instead of investing in better care for patients, they just want to keep their profits flowing. To give you an example of how profitable these corporations are, in 2021, the CEO of DaVita was compensated $73 million in 2021. $73 million for one CEO, making him one of the highest paid healthcare executives in America. And I say this because there's a lot of money being thrown around in terms of this race, the campaign for Prop 29. So getting to the bulk of it, essentially what Prop 29 would do, at the very heart of it, we're just asking for a doctor, a nurse practitioner, or a physician's assistant to be on site during clinic operating hours. I can continue. I'm not sure if you had a follow-up question, if I addressed all that.
Yeah, and can you talk a little bit about also, one of the key talking points that we're seeing in all of these ads that are flooding us everywhere. So thank you for talking about the money is, will this cause people to have lose access to dialysis?
Sure, I can address a few of those concerns too, of common questions that we're hearing from people. There's a lot of misinformation being thrown around this campaign as well. So currently, as it stands, in most dialysis clinics, there are low-paid workers who are pressured to rush patients through treatments. So Prop 29, again, it will help to ensure there's always a doctor, a nurse practitioner, or physician assistant on site. Take in mind what I was saying before about all the things that can go wrong while these patients are sitting in chairs: strokes, heart attacks, patients bleed out. I've gotten pictures of dialysis patients where, they're just bleeding uncontrollably during or after their treatment. Imagine how terrifying that must be for a patient sitting in that chair who's already, in a fragile condition. So again, we just want to ensure that there's somebody there, an advanced practitioner who can help out, if something goes really wrong at these clinics. Right now, when serious problems happen, most clinics just call 911, but in case the ambulance doesn't arrive on time, it would provide peace of mind for so many of these patients to have someone there to help them. And again, studies have linked frequency of physician contact with better quality of care and lower mortality rates for dialysis patients. Prop 29 would also require infection reporting to ensure that patients and their families are informed about unsafe clinic conditions. It would prohibit discrimination based on payer type. We believe that clinics should provide the same level of care for all patients, regardless of the type of insurance they have. Currently, dialysis clinics want to cherry pick their patients, the ones who have private insurance, because they get lower reimbursement from Medi-Cal or Medicare patients. So Prop 29 would ensure that every patient got equal treatment. And lastly, to address, one of the top concerns that we're hearing from the opposition, there is Prop 29 would help keep clinics open. Currently, hospitals are required to get approval from the state to reduce or close services. Prop 29 would ensure that dialysis clinics are held to the same standard. So Prop 29 would help keep clinics open.
So I really just want to underscore that point, because there's a lot of misinformation that's being shared about this, that it would reduce people's access, but it actually would ensure their access, making sure that they can't close on a whim, and also ensure that the people who are receiving this necessary life-saving treatment have the things in place to make sure that they're treated with dignity and care and the appropriate level of care, especially given their fragile health conditions. So thank you, Renee, so much for sharing that. So I know one of the other questions that comes up is like the California Medical Association and these other nurses associations are opposed. Can you speak a little bit to why they're opposed? Because I know that raises some concerns for people when they see these institutions that they think they should be able to trust opposing a measure that on its face seems pretty common sense and certainly necessary.
Yeah, I can't really speak for the other organizations and why or why not they have decided or, to not back our proposition. Prop 29, though, has been endorsed by the California Democratic Party, the California Labor Foundation. So we do have support amongst, grassroots supporters and amongst many dialysis patients. Also keep in mind that, inside these clinics, these patients are kind of like a captive audience where they're just being inundated to this no on 29 information. And again, please vote yes on 29. So just to give you an idea, there is, the opposition, including the dialysis industry, has already spent over $80 million on this campaign. $80 million just to try and defeat reforms within their own industry. And again, we're simply asking Californians, just wouldn't you want a doctor, an advanced practitioner on site at all the times? Imagine if it was your grandmother, your parent, or even your child in that chair. Wouldn't you want to be able to provide them with the best care?
Thank you so much, Renee. Really appreciate you being here and being able to share this, because I know sometimes the messages that we're hearing, especially given $80 million in campaign spending, are not, the really common sense ways that we should be moving forward. And I just on an editorial note, one of the challenges, of course, is that when you have membership organizations, that very moneyed interests can pay for memberships that can help sway the votes and to influence who at what positions they end up taking. And so we do know that has happened with DaVita and Fresenius paying those memberships. So when you see some of the doctors and nurses associations, just take into account that they're membership organizations and many of their members are heavily invested in this industry. And that's actually one of the things that this ballot measure also will do, is require some disclosures about who is invested in this industry. And so just wanting you to be aware that sometimes it's important for us to follow the money. So thank you, you, Renee. And if anybody has any questions, I know we only have about 5 minutes left, but please make sure you put them in the Q&A or in the chat so that we have an opportunity to be able to answer those questions for you. And so with that, that brings us almost to the end of our time, but we would be remiss if we did not at least share with you some of the important information around voting as we are coming up on Election Day in just 1 week. So I have a voter guide. You can access, you can access this at .org/. You can. Apologies for that. Apparently now I'm losing signal, so I'm not sure if something's happening over in my area, but I will try my best. Okay, sorry about that. So Public Health Advocates has a voter guide. You can find it at phadvocates.org/2022 voter guide. And we encourage you to go there to just be able to find out some of the positions that we have taken on your 2022 ballot. Please also don't forget to vote on November 8th, which is next Tuesday. So we have 1 week left, or earlier by mail. No voter ID is needed in California, important. Also, postage is not needed to be able to submit your ballot. You can also drop it off at any of the voting locations or in any US mailbox. So just know that we try to make it open and simple for you to vote in California. You can check your voter registration at registertovote.ca.gov. And you can also register on Election Day with same-day registration. So that's an important thing to know. You can show up in person to one of the voting centers and vote the same day as the election or in any of the days leading up. And lastly, we just wanted to make sure that we shared with you our social media. In addition to our voter guide, please consider following us on Twitter or Instagram or Facebook and LinkedIn or even on YouTube. We also have PHA Radio, where we're covering some of the really important issues in public health. We also, obviously, this is part of our state policy portfolio, and we also take positions on bills and budget asks. And so it's a really great way for you to stay involved in public health. And be involved in some of the work that's happening statewide. We do local work and we also do statewide work. And so we're really, really thankful for all of you being able to be with us today to ask the questions that you have. Please continue to ask them. If you reach out to us on social media, we'll be sure to connect you with any of the campaigns. If you have any last minute questions, I want to thank all of my panelists today for being with us today. You all were amazing, and you're doing really great work out here trying to champion the best of what we have to be able to protect Californians and take good care of us. So we are wishing all of the campaigns well as we enter into this last week. And please let us know at Public Health Advocates if there's any more that we can do to be able to support you. And again, thank you to everyone for being here, and again to our panelists. Yay. All right. Thank you, Holden.
Unmuting. Yeah, great job. And thank you. It seems like it went well, really well.
Yeah, it was great to have all these folks. I'm so excited.
All right. Well, yeah, people are just
People
trickling
filling
out.
their ballot. Thanks, Nancy. Thanks, Zuri. Thanks, Crystal. Thanks, Valerie.